Hasteni lukorono kaham shak naikil muni sheb rinani bagai hapani bakhakti kaham keno samwng khlai tongkha kami hatai rokni simi romai hasteni joto thairogo kaham no shak naikil muni sheb rinani bagai tabungni simi dalbidal samwng batang yago naharka haste hapang rajakhor awlini pragya bhavane video conference by khlai salgwra Tripura unakoti te gomoti hangkor sakham nogo integrated public health laboratory ni samwng batang songsai rwjakha phasalo abo haikeno samani nuksaka hasteni montri okra Dr.Manik saharo montri ni Ayushman Bharat Health Infrastructure Mission a Integrated Public Health Laboratory Rock achok rijaknai Ashanli panda phawi manjak phaikha hasteni sakham tang bedini okra naikolan Dr. Supriya Malik Family Welfare tang bedini Director Dr. Anjan Das National Health Mission Tripura tang bedini okra naikolai dike chakmate Agartala Sarkari Medical College ni Principal Dr. Kumar Saha Ashala Montri okra saklaika lukurokno kaham sak naikol mungte sheb rinani bagino magnang sak naikol mung rinani bagai sheb naharka Bharat hapang aro 147 test khlainani bagai sheb manai dolaite salchi Tripura hangkor aboro achugoi rwjakha.
To the people, Government of India launched free diagnostic service initiatives in addition to the testing facilities available under various programs. Now, to augment and strengthen the competency for quick testing, case detection, surveillance, and outbreak management, setting up of integrated public health laboratories as one of the interventions under Pradhan Ayushman Bharat Health Infrastructure Mission has been envisioned. Integrated public health laboratories are a relentlessly new concept in public health aiming to improve disease surveillance, diagnosis, and response at the district level. They essentially combine various laboratory services under one roof, offering a more comprehensive and efficient approach to public health testing. IPHLs extend to a laboratory systems providing comprehensive services including infectious disease diagnostics and other diagnostic services such as hematology, clinical chemistry, microbiology, and pathology, all combined under one laboratory service. The IPHL are envisaged to play a key role in early detection of disease, surveillance, monitoring of therapy. Also would provide accurate and timely data for analysis, research, information, and policy decision to detect, prevent, and respond to public health threats in real time. It will support block and district surveillance units and act as a hub to provide technical support to block public health labs and other peripheral laboratories for sample collection, testings, and referrals as per Government of India guidelines. In integrated public health laboratories, around 147 tests may be done for smooth functioning of whole work dedicated manpower such as microbiologists, laboratory technicians, laboratory assistants, and laboratory attendants would be present at IPHL.
Ashanli panda virtually phawi manjak phaikha kendriya health family welfare tang pedini montri Dr. Mansukh Mandbia Assamni montri okra Himanta BiswaSarma Kendra Prati Montri Bhagwant Khuba Bharat hapangni pharmaceutical department ni senior economics advisor Adesh Kumar Chaudhary. Bureau report Kokora.